On 21st July 2021, the Deputy Minister of Health for Liberia, Dr. Francis Kateh, visited the COVID-19 treatment centers at Dossen Hospital and Cavalla Rubber Company, both in Maryland County, to assess patient care and well-being at the facilities. Accompanied by the Deputy Director of Partners in Health Liberia, Viola Karanja, and Dr. Emmanuel Flomo, Medical Officer at Dossen Hospital, and other officials, Dr. Kateh interacted with the patients and encouraged them to continue with their treatments, observe COVID-19 safety protocols, and further be advocates for COVID-19 prevention in their communities.
It was a good experience talking to the patients. The patients are excited about what has been done to them. Basically, I want to say a big thank you to the partners, especially partners in health, for working along with the team here. Yes, government has the sole responsibility of taking care of its people, but based on the partnership we develop with our international NGOs and others, that helps to make sure that everything that is done properly to help the people to save their lives. And so we are so grateful, and we think that the services that we are providing, those services are making a positive impact on our people.
The treatment centers are currently admitting symptomatic cases and with or without conditions such as diabetes, hypertension, HIV, and tuberculosis.
Basically, we admit severe and critical patients here. But notwithstanding, we look at other factors, like the age is a major factor. People who are elderly, we treat them because they stand a risk of deteriorating. And then even those who have comorbidities, especially diabetes, hypertension, and other conditions. And we also admit people with mild to moderate COVID here, based on where they come from, their home, and how it is. Because one of our primary goals is to stop the transmission of COVID. So now, what we do is you test positive, and then we don't have the team to go out and assess the home. We keep you here until the home-based team, they go to your home, assess your home, and then if it's fit for home-based care, we transfer you to home-based care. If you are here, you are stable, and then you don't have like other predisposing factors or other risk factors that will cause you growing like having severe symptoms or deteriorating to be and having severe symptoms, we transfer you to another treatment unit we have at CRC, where we have most stable patients and asymptomatic patients, and then you stay there for the time frame, and then after the 10 to 14 days, you are discharged home.
I'm one of the COVID-19 patients, and basically, I wasn't feeling sick. I took people because I work at a mining company, exploration company, so I took some Chinese workers over for treatment because they were feeling symptoms of malaria and typhoid. So took them over to Harvard. When I went to Harvard, they treated, went there to the test, so I saw that they were doing COVID-19 tests. So I'm like, okay, since we are here, let's just take the test. And then unfortunately for me, we took the sick people. I'm the one who came down with the COVID-19. But so far, so good. I feel okay. I don't feel sick. I don't know how COVID make people feel. The only thing I can say is that I lost taste and smell. That's major. So when you're losing taste and smell, tell people they get COVID already. But so far, so good. I can say I'm doing fine.
Partners in Health is supporting the facilities with the necessary medications, food for patients, and other essentials to facilitate quality patient care and continuous adherence to COVID-19 prevention protocols.
The patients are admitted here, we ensure the patients are well fed. The ones on home-based care, we also assist in ensuring that they are well supported. We have the mental health team also working with the mental health team, with the county health team, so that the psychological aspect is also looked into. We also support the case management. We are also in that pillar. We work with the doctors from the MOH and also from the CHT, so that it's more of collaboration, working together as a team, ensuring that all that is needed from IPC to the drugs that are available, so that we can give the care.
What we don't want to see is that people come into the treatment unit. And so what we're trying to do now is to promote good health education an individual following the protocol. And as long as we break transmission within the community, the sooner we break transmission among families, the better we all can be and the safer this country is going to be. So this is why we have instituted a rapid test, and with the rapid test we can begin to do surveillance, and during the surveillance we can go into the community and break, if there is any transmission, then break those transmission.
The Deputy Minister of Health also donated infection prevention and control items, including buckets, detergents, and hand sanitizers to the county health team.